This is Introducing Herbal Medicine, Video 3, Part 1, entitled Recurrent Urinary Tract Infection. Treatment of urinary tract infection in mainstream medicine is normally confined to the use of antibiotics, but increasingly antibiotic resistance is developing among the bacteria causing UTI. In 2014, World Health Organization named E. coli as one of 7 life-threatening bacterial species which are now resistant to most antibiotics. And E. coli is the most common cause of UTIs. The unfortunate thing is that no new antibiotics are being developed since the 1980s because research into antibiotics is not considered as profitable by pharmaceutical companies. So let's look at a typical cycle of recurrent UTIs. To take the example of a woman with cystitis caused by E. coli who gets a prescription for an antibiotic which works, and by the end of the course of tablets she has no symptoms. But 4 to 6 weeks later she develops another UTI and she again seeks antibiotic help, and a vicious cycle develops. This UTI resistance occurs because the antibiotic leaves pockets of live bacteria in the urinary tract that increase in numbers over time. And these bacteria are more likely to be antibiotic resistant. So next time when she gets some antibiotics, they may not work so well. Herbal medicine and lifestyle can be used to combat UTI reoccurrence with or without the use of antibiotics. So the general advice would be to continue with antibiotics if prescribed, and then to take lifestyle measures. These might be drinking plenty of water and or cranberry juice, and taking supplements of, say, D-mannose, which might help. And to make up a tea, 30 grams of mixed dried herbs as infusion, or a mix of any of the following: corn silk, marshmallow leaves, horsetail, agrimony, elderflowers, pellitory, ribwort plantain, bearberry or yarrow. Any of these may help. And to continue using this tea for a further 2 to 3 weeks after all the UTI symptoms have actually gone, and this will ensure that all the residual bacteria are killed. So to consider the efficacy of herbs for infection. Herbs have been used for thousands of years, and yet the bacteria have not developed resistance to them. Microbes are not able to adapt to them because herbs contain numerous active compounds with antibiotic properties rather than being a single compound as found in modern medicine. So herbal compound complexity actually prevents microbes from developing mechanisms of resistance and can be enhanced by combinations of herbs. So this is quite normal practice amongst herbal practitioners. To summarize then, herbs can offer safe and effective treatment for UTIs in combination with modern antibiotics. Alternatives to modern antibiotics as microbial agents, they can be used in their own right, and this will reduce the need for antibiotics, of course. Bacteria will not develop resistance to the action of herbs due to their complex mix of active compounds. Herbs can fight infection by working on two fronts, through directly killing effects on the microbes and by stimulating the body's own immune response. So that's the end of this video, and thank you very much for listening.